हेलो एवरीवन। आज का हमारा टॉपिक है इंट्रोडक्शन टू फार्माकोलॉजी। मीनिंग: फार्माकोलॉजी इज द साइंटिफिक स्टडी ऑफ ड्रग्स एंड देयर इंटरेक्शन विद लिविंग सिस्टम्स. It explains how drugs act, how they move in the body, why they are used, and what harmful effects they may produce. The word pharmacology is derived from Greek word pharmakon, that means drug, and logos mean study. Next, drug. A drug is a chemical substance that, when administered to a living organism, produces a biological effect and is used for: first one is diagnosis, for example contrast media. Next one is prevention, for example vaccines. Third one is treatment, for example antibiotics. And last one, use of drug, is relief of symptoms, for example analgesis. Aims and objectives of pharmacology. Pharmacology helps to: first one is understand drug actions. Second one is select the right drug for the right patient. Third one is determine correct dose and route. Fourth one is prevent adverse drug reactions. Fifth one is promote rational use of medicines. Major branches of pharmacology. First one is pharmacodynamic. Pharmacodynamics: what the drug does to the body. Pharmacodynamic may be defined as what the drug does to the body. It explains mechanism of action, receptor of interaction, dose-response relationship, therapeutic and adverse effect. Examples: paracetamol reduces fever by acting on the hypothalamus, and atropine increases heart rate by blocking muscarinic receptors. Muscarinic receptors. Next one term is pharmacokinetics. Pharmacokinetics defined as what the body does to the drug. It involves ADME. That means A means absorption, movement of drug from the site of administration into bloodstream. Oral drug absorbed in stomach or intestine. IV drugs have 100% bioavailability. Next one, distribution. Transport of drug from blood to tissues and organs. Influenced by blood flow, plasma, protein binding, and lipid solubility. And next one is metabolism. Biotransformation. Conversion of drugs into inactive or active metabolites mainly occurs in liver. The enzymes cytochrome P450. And last one is excretion, that is removal of drugs from the body, mainly through kidneys, also through bile, sweat, saliva, breast milk. Third one term is pharmacotherapeutics. Deals with the drugs to treat disease and drug selection. Next, dose adjustment. Monitoring therapeutic effect. Example: insulin for diabetes, antihypertensive for high blood pressure. And next, fourth term is toxicology. Toxicology may define as study of poisonous effects of drugs and chemicals. First one, drug overdose. Second, adverse drug reactions. Third one, management of poisoning. Example: paracetamol overdose, liver damage. Fifth one is chemotherapy. Uses of drugs to destroy or inhibit disease causing organisms without harming the host. For example, antibiotics, anti cancer drugs, and anti parasitic drugs. Next term is clinical pharmacology, study of drugs in human beings. Clinical trials, drug safety and efficacy and adverse effect. Sources of drug, plant source, morphine means opium poppy and digoxin digitalis. Animal source, insulin and heparin. Mineral source, iron, lithium. Next one is synthetic source, paracetamol and aspirin. Next one is biotechnological source, that is vaccines and recombinant insulin. Routes of drug administration. First one is enteral. It includes oral, sublingual, rectal. Next one is parenteral. It includes intravenous, intramuscular and subcutaneous. And third one is topical, that is skin creams and eye drops. And next, inhalation, that is gases, aerosols. Factors affecting drug action, age, body weight, gender, disease condition, route of administration, time of administration. Adverse drug reactions, ADR, any undesirable or harmful effect occurring at normal doses, that is allergy, side effects, toxic effects, idiosyncratic reactions. Importance of pharmacology, safe medication administration, prevention of medication errors, monitoring side effects, patient education, emergency management of adverse reactions.